Hey folks, Doug Blake with Body Design University. In today's video, I'm going to pull you into chapter 23, talking about chronic health conditions, and particular today will be hypertension. Just keep in mind, this is probably of all the chronic health conditions that are listed in this chapter, this is probably one of the more important ones. And when I say that, I'm talking about how it's representative on their actual exam. So if you're going to see questions about these chronic health conditions, you'll probably see one on hypertension, which is why it's one of the more important ones to keep in mind or study and memorize. One of the key things, any of these chronic health conditions, remember, there's generally two tables that go along with them. One of them is the physiological considerations, and then the other is going to be the basic exercise guideline table. In the case of hypertension, there's a couple of other things you do need to know, and they have given you some bullet points on the revised guidelines. And so you do need to memorize these numbers, okay? Normal blood pressure is now, the guidelines changed a couple of years ago, normal guidelines are now less than 120/80. Elevated blood pressure, memorize these numbers. Make sure you understand what it means. So if I was to tell you a person had a blood pressure of 122/78, what are they, right? You should know that. Go back in here and go 122, right, 122/78 is elevated. You should know that. Stage 1, stage 2 hypertension, hypertensive crisis. You should know these numbers. Write them down over and over until they just become embedded in your gray matter. Of course, memorize your side panel terms that they give you. They're not difficult to memorize, but now we get to the most important things that you need to know when it comes to understanding hypertension from the perspective of NASM, right? Asking you these questions on a test. And that's going to be these two tables, tables 2310, 2311. First one is the physiologic and training considerations. The goal here is to make these boxes of information. Remember, what NASM did is they took a ton of information and they squished it and compressed it into easier to digest pieces of information. And they're still too long. So blood pressure response, and I'm reading from that first table, 2310. Blood pressure response to exercise may be variable and exaggerated depending on the mode and level of intensity. I have no idea what that means. It's a full sentence, so I'm not going to try and memorize it. So what do? You try to compress that even further, something that you can, quote, digest, right? And that generally comes down to what we call irreducible minimum content. It's generally taken an entire sentence and looking for one or two words or phrases that effectively summarize what they wrote, but summarizes it in a way that you can remember it and it's easy to retrieve. Does that make sense? And that's all you're trying to do with all of this. I'm not going to go through each one with you. Maybe I'll do a video on how to actually do that. But what you want to do is you want to read through it, and when you rewrite it, which is what you want to do, read it and rewrite it, try to reduce it down to a couple of words or a phrase, something like that, that makes this sentence make sense, but not have as many words as they gave it to you. That's called irreducible minimum content. In other words, you want to reduce it down to a couple of words or a phrase without losing the effective meaning of the sentence. All right, that's just a really effective study technique. It really is. So that's table 2310, 2311. Of course, basic exercise guidelines. I've said this before in other videos. If you were to look at this table and compare it to the other tables of, like this one is diabetes, which is longer, of course, or we go back, exercise and diabetes, look at any obese clients. If you look at the tables, for the most part, they're going to be very similar in their content with some minor variations. That's what I'd be looking for when I'm sort of comparing these. And of course, this table bleeds over into page 778. And of the rows, now look, mode, stationary bike, treadmill, frequency, 3 to 7 days per week. You'll notice that on other chronic disease tables, they'll say 3 to 5 days a week, or whatever the case is. You understand that that's not a whole lot of difference in memorization. Basically, all you got to do is remember 3 minimum, And in some cases, it's 5 days a week. Some cases it's 7. In this case, it's 7. Intensity, yeah, 50 to 85%, sure. Max heart rate. Cardiorespiratory training can start as low as 40% of heart rate, right? Max if needed, and be progressed as tolerated. That's fine. Duration, 30 to 60 minutes. You're going to find for the most part, like 30 minutes is minimum. This is not difficult to memorize, folks. You're going to do basically all the assessments with them for folks with hypertension. Flexibility, sure. Go to the next page. Now, look, here's the deal. I'm on page 778. The table is more important. Of the two tables, table 2311 is more important. Inside of table 2311, probably the two most important rows of information that you want to know and understand are the resistance training rows. That goes for every one of these, by the way, these chronic conditions. Resistance training and the special considerations. Again, look at what they're telling you in the special considerations. See if you can compress down to irreducible minimum content each of these sentences. It's a good way to practice. Progress client slowly. I don't know how you can compress that anymore. To be honest with you, progress client slowly. That's about it. 3 words. That's pretty good. But the other ones you can squeeze down. Resistance training, 1 to 3 sets, 10 to 20 repetitions. You're going to see this throughout all of these chronic conditions. Hypertension in particular, for sure, is going to have a noteworthy insert here outside of the other ones, which is the concept of isometric training. So here you're going to see they're going to use isometrics because you don't want to hold your breath generally when you have hypertension. Circuit or peripheral heart action training, PHA, is a viable option with appropriate rest intervals. The point is that you don't need to read a whole lot. Now, there's not a ton of information to read, and they do give you some important information on how, you know, you should do basically a standing exercise, right? Figure 23.3 versus a lying exercise. Why? Because there can be additional unnecessary stress placed on the cardiorespiratory system, cardiovascular system if you're lying on your back. Okay, so that's all they're saying here. Again, your main focus is on these 2 tables, trying to memorize as best you can and understand the material. Like I say, table 2311, that's your go-to. Try to compress down the information in 2310 to more manageable pieces of, I use the word digestible information, so that you can memorize it, understand it, read, write, recite. Keep in mind, and by the way, I hope this was helpful. If you are going through this video and you're saying, yeah, I got that, that makes a whole lot of sense, now I can really understand it, or in your studying, you're writing it down and you're actually memorizing this stuff, then write the word understood in the little comment box. And also, when you look in that description, if you want full access to the NASM study materials, the program that we provide that has all of the chapter study videos, we have an entire audio book broken into the actual chapters themselves. We've got quizzes and exam studies, right? So we actually have 3 full practice exams, very close to the actual NASM exam itself. Very helpful to utilize those. But if you want access to all of that information, Quizlet, we've got all of these study resources. Please click on the link below in the description box. Also, head over to the Facebook group if you are not in that particular group. Love to have you in there and participate. Also, Wednesday nights, we do a live study using Quizlet, by the way. If you've never used Quizlet, you got to use it. It's a great study resource, but we format it into what's known as Quizlet Live. Lots of fun, very helpful for you it'll help you to study, pick up the speed component that's necessary when you take the NASM exam. As always, I want you to have a great week, and we will see you next week. Take care.